The alternate care site, known as an ACS, is a non-traditional setting to allow isolation and quarantine for COVID-19 individuals and those awaiting COVID-19 test results. The purpose of the ACS is to offset a possible surge of COVID-19 cases while allowing the regional healthcare system to remain functional. Hi, I'm Paul Gullickson. I'm Associate Vice President of Strategic Communications at Sonoma State University.
Hi, I'm Tina Rivera, Assistant Director for the Department of Health, County of Sonoma. The County of Sonoma is grateful to Sonoma State University, and it's heeding the governor's call to make available state property for purposes of developing the ACS. In addition to providing a place to quarantine, this site will also provide essential care for non-critical patients who are vulnerable to COVID-19, who are over the age of 65, have high-risk medical conditions, or who may or may not be sheltered and unable to self-isolate. Patients suited for this site are those needing low levels of care, mainly those with symptoms or mildly to moderately symptomatic if COVID-19 positive, and in need of a few days of monitoring. The medical staff will work with all patients to ensure that they receive the care and services necessary for their health and safety. Individuals who are unsheltered will also be enrolled in the county's ACS Initiative program, which provides intensive care coordination for vulnerable individuals to improve their well-being and self-sufficiency. To be clear, the site will not admit residents who require high levels of mental or physical health care. The site is neither a criminal justice center, a homeless shelter, nor a substance use disorder treatment facility.
Sonoma State is proud to be a partner in the creation of this alternate care site, which will provide relief to our community and specifically to our local healthcare workers. We believe this site will respond to the community's greater healthcare needs while respecting that our primary focus as a university is the education of our students, as well as the health, safety, and welfare of all those within our campus community. All individuals at the ACS are expected to follow the shelter-in-place rules outlined by the county health order. Individuals who do not abide by the shelter-in-place order will be asked to leave the site. Additional rules at the ACS will include no visitors and staff-supervised walks and smoke breaks at designated locations. There will be security on site at all times, as well as health and social service teams who will link individuals to services that will support patients during and after their stay.
A decontamination and exit plan are being finalized for the closing of this site. As with other natural disasters where the county has sheltered the homeless, efforts are being made to find appropriate shelter placements during the transition and closing of the ACS. Unsheltered individuals will not be turned out onto the streets of the university or Rohnert Park. We want to thank the National Guard for assisting with the setup of this site and Sonoma State for being wonderful partners. For more information, visit socoemergency.org.